Hello, this presentation is Diabetes, a biopsychosocial review by Sheila Wiley, Sunday, June 28, 2026, Health Psychology with Professor Esterling. As an introduction, the endocrine system complements the nervous systems into controlling bodily activities. Diabetes is a chronic endocrine disorder in which the body is not able to manufacture or properly use insulin. If it is the leading chronic disease in this country and one of the leading causes of death. The functioning of the digestive system, food is first lubricated by saliva in the mouth, passes through the esophagus, moves through to the stomach, which produces various gastric secretions, including pepsin and hydrochloric acid to further the digestive process. As food moves from the stomach into the duodenum, the pancreas becomes active in digestion. So the pancreas releases enzymes that help break down proteins, carbohydrates, and fat. It also produces insulin, which allows glucose to enter the body tissues. The liver supports digestion by producing bile, which helps break down fat in the duodenum. Bile is stored in the gallbladder until it is needed. So, as we see the lipid profile test, most metabolic byproducts dissolve in water and travel easily through the bloodstream. Lipids such as fats, cholesterols, and lecithin are not water soluble and must be transported by lipoproteins. High levels of lipids in the blood are called hyperlipidemia. Hyperlipidemia is common in conditions like diabetes, certain kidney diseases, hyperthyroidism, and alcoholism. So here we show how normal metabolism looks. You have your brain activity, weight loss, possible cancer prevention, type 2 diabetes reversal, reduction of the inflammation, increased high production, insulin resistance, anti-aging, life extension, heart health promotions. So these are all some of the benefits. Also, there's intermittent fasting. So there are three main models that help explain carbohydrate metabolism. One follows how carbon from food becomes energy. Another shows how insulin and glucagon keep blood glucose levels steady. The third highlights small metabolites like pyruvate and acetyl CoA that connect different metabolic pathways into one system. Metabolism's what we eat and change into energy. That's what normal metabolism looks like. How And then in addition, micronutrients, then carbohydrates, 130 grams per day. This is with normal metabolism. What food contains carbohydrates, proteins, fats, change to heart healthy fats, eat less saturated fat, get rid of trans fat, choose more mono unsaturated and poly unsaturated fats, watch the calories. This is what happens during normal metabolism. So now, how does the body channel metabolism, or how the body channels metabolism? Insulin receptor, insulin glucose channel closed. Insulin is the key that unlocks the glucose channel. Glucose channel opens, then the glucose enters the cell. We have carbohydrates, and from the pancreas goes up, the glucose enters. This is for a normal functioning body. Liver goes down. The liver releases stored glucose. After we eat, the blood sugar level rises, and then the glucose helps to bring the sugar level back down. The process takes about 2 hours to return to normal. This is for a normal functioning body. However, abnormal metabolism, the stomach changes, glucose enters the bloodstream, the pancreas makes little or no insulin. Little or no insulin enters the bloodstream, glucose builds up in the bloodstream, as we see here. Massive amounts of insulin, damage function, TD, T2DM, as we see this particular diagram. So now we're getting into diabetes. So we've gone from abnormal metabolism. And so when you have an abnormal metabolism, which is how the diabetes can come about. So there are a few types of diabetes that we want to bring up. Actually, one that is not on the screen is pre-diabetes. But then there is type 1 diabetes, wherein insulin must be used daily to live. The pancreas makes little to no insulin, 5 to 10% of the diabetes population. Okay, so about 5 to 10% of the diabetes population is type 1 diabetes. Then there's type 2 diabetes. It's progressive and insulin slowly works. It's a chronic disease. 90 to 95% of the diabetes population. So we see that there's a problem and there is much research that needs to be done on this. Then there's the diabetes when you're pregnant, when a woman is pregnant, which is the gestational, which occurs once again during pregnancy. So how can you diagnose if someone has diabetes? There's something called A1C testing. And as we see to the right, there is a diagram where that says normal. If your A1C level, which you can actually go and get blood work, we'll talk about that in a minute. If your level is less than 5.7%, you're normal. You have normal metabolism. However, pre-diabetes, you're getting there, greater than or equal to 5.7 and less than 6.5. So you're in between 5.7 and 6.5%. So you're at pre-diabetes. So this is where actually we'll talk about it more. However, diabetes greater than 6.5% A1C. So testing for diabetes should be done in a clinical setting, like your doctor's office or a lab. If your blood glucose is extremely high or you have clear symptoms along with one positive test, your doctor may diagnose diabetes without needing a second test. The A1C test measures your average blood glucose for the past 2 to 3 months. The advantages of being diagnosed this way are that you don't have to fast or drink anytime. So the biological etiology of type 1 diabetes. So there's a change in the gut microbiota may play a role in the development of type 1 diabetes. Shifts in gut bacteria can influence the immune activity, potentially raising the risk for the disease. Early life factors like birth mode and diet also matter, though researchers note that these links, while strong, are still associations rather than proven causes. Social and psychological factors like chronic stress or socioeconomic conditions can also shape a person's risk. So there was a study by Zhou J et al. That found that rats missing the TREX1 gene developed type 1 diabetes on their own. So by about 4 weeks old, they show high blood sugar, loss of insulin producing cells, and strong inflammatory responses. The researchers suggest that when self-DNA builds up, it triggers an immune reaction that leads to chronic inflammation and beta cell damage, creating a useful model for studying type 1 diabetes. TREX1 normally helps clear leftover DNA fragments so the immune system doesn't mistakenly attack the body. So the study by Chong Ni et al. Points to several biological factors tied to type 2 diabetes. They highlight insulin resistance, beta cell functions, liver glucose production, inflammation, and oxidative stress, all of which interfere with insulin signaling. They also note that how the gut microbiome shapes glucose metabolism. Overall, natural hypoglycemic substances show promise because they can target multiple pathways involved in diabetes. So they emphasize a few major factors: insulin resistance, the breakdown of beta cells functions in the pancreas, and the liver's tendency to boost glucose production. They also noted how inflammation and oxidative stress makes insulin signaling even worse. One interesting piece was the gut microbiome, how the balance of gut bacteria can shape glucose metabolism. Altogether, it shows how many systems interact in type 2 diabetes. So in conclusion, type 2 diabetes develops through a mix of genetic and environmental factors with insulin resistant and beta cell dysfunction at the center. The author reviewed natural hyperglycemic substances, often plant-based, that may help lower glucose spikes, improve insulin signaling, and protect beta cells. They note these compounds are promising, but most evidence comes from early preclinical studies, and human trials are still limited. Because of that, lifestyle changes and standard medical care remains the most reliable early intervention. So, and what that's saying is you can probably just take like a more holistic way out, but of course, they are recommending, or it is recommended that medical care be taken. Okay, so those precautions are there. Those precautions are still there. So, type 2 diabetes is an autoimmune disease. Instead, it develops when the body becomes resistant to insulin and the pancreas cannot keep up. So over time, those insulin producing cells struggle and managed blood sugars become a lifelong process. A study was conducted focusing in on adolescents with prediabetes. It examined whether adding a measure of socioeconomic status, SES, to existing prediction models could improve the ability to identify youth with prediabetes who are most likely to develop type 2 diabetes. The researchers found that young people from lower socioeconomic backgrounds were at greater risk of progressing to type 2 diabetes. While current prediction models mainly focus on biological and clinical factors, such as blood glucose levels, body mass index, and age and family history, the study shows that including socioeconomic factors made the prediction model more accurate. Socioeconomic status reflects factors such as income, education, neighborhood conditions, and access to healthy food and healthcare, all of which can influence diabetes risk. Based on these findings, the author recommends that healthcare providers consider both medical and social factors when identifying youth who may benefit from earlier monitoring and preventive interventions. So the psychological etiology of diabetes. So there was a study that I looked up, and it was looking at the connection between diabetes and PTSD, noting that people with diabetes often had higher rates of PTSD, which can make blood sugar management more difficult. The author also explained that PTSD-related stress can disrupt glucose control and overall health, and they argue that treating both conditions together during integrated care could improve the outcomes. They observed this link in real-world patient groups, but it didn't test an intervention to see whether addressing PTSD directly improves diabetes management. So more recent research strengthens the connection. One study found that veterans who experienced meaningful reductions in PTSD symptoms had about 49% lower risk of developing diabetes. And another genetic study showed that PTSD increases diabetes risk partly through its ties to obesity and hypertension. So together, these findings highlight the value of coordinated care for both conditions. So now moving into the social etiology of diabetes. So I came across an article which was entitled Effects of Social Factors and the Natural Environment on the Etiology and Pathogenesis of Diabetes Mellitus, examine how social and economical factors shape the development and progression of type 2 diabetes. So the authors argue that beyond genetics, influences like socioeconomic status, education, neighborhood safety, access to healthy food, and exposure to pollution all play a role in the social etiology. Chronic stress, poor sleep, physical inactivity, and psychological strain, often tied to these conditions, can trigger low-grade inflammation that leads to insulin resistance. Their main point is that preventing and managing diabetes requires addressing these broader social and environmental factors, not just focusing in on the individual behaviors. So now I want to tell you to be proactive. Measures to prevent the development of diabetes. So a few measures are Marco Caldron and colleagues in Writing in Children highlight the growing need for early type 1 diabetes screening in kids. So this particular article, they explain the disease progresses through 3 stages, starting with autoantibodies and normal glucose, then autoantibodies with impaired glucose, and finally clinical onset. Their argument is that wider screening, so screening, especially between the ages of 2 and 6, can catch the condition earlier, reduce emergency diagnosis, and support better long-term outcomes. So also going to the doctor for regular visits and checkups, checking the blood pressure, weight, activity, usage status. At least twice a year, check your A1C, dental cleaning, and exam. Keep on top of that. That's what we have insurance for. Also, continue to be proactive. These are measures to prevent the development of diabetes. At least once a year, check cholesterol profile, kidneys, and eyes dilated exam rate. Eye exam. Feet, check your feet. Physical and sensory exams. Other, like the flu shots. Get vaccinated. Remember, COVID-19 was big, right? So it was recommended that you get the COVID-19 and pneumonia vaccines. So also self-care behaviors. How can you administer self-care? Healthy coping, healthy eating. I know that's kind of rough. Being active, taking medications, monitoring your A1C level, reducing risk, and problem solving. So we can continue with being proactive by having an eating plan. There is no one diet that fits diabetes. There are things such as maybe the Mediterranean diet, the DASH diet, the plant-based diet, the plate method, nutrition, read food labels when you're going to the grocery store. No foods are off limits. Meal planning, right? Instead of just eating like randomly or going to the grocery store while you're hungry, meal plan. So why eat a healthy diet? Because it helps to manage blood sugar and lipids, reach blood pressure's goals, maintain body weight or lose weight if needed, prevent complications. So there was a clinical study for the detection of diabetes. So Yara Liu et al. Reviewed 18 studies on metabolimics and lipidemics in children with type 1 diabetes to identify early metabolic shifts that could serve as biomarkers. They found changes in metabolites and lipid profiles, such as higher branched chain amino acids and altered lipid levels. They appear before symptoms or autoantibodies. These findings suggest potential tools for earlier diagnosis and better risk assessment. However, the author note that these markers are still used mainly in research, and larger standardized studies are needed before they can be part of the routine clinical practice. So here is some evidence-based treatment. There was a randomized pilot trial conducted in the community setting that was both practical and effective. Participants improved their diabetes self-management. Families became more involved in self-care, and blood sugar control showed signs of improvement. That's great news. The researchers concluded that community-based programs can increase access to diabetes care and recommended larger studies to confirm the results. There are also a couple of more evidence-based treatments here. We're going to move on because we're running out of time. So the assessment tools used to study diabetes. The study created a scale to measure how well people understand the benefits and risk of using complementary therapies for diabetes. After thorough testing, the authors found it to be a reliable tool for nurses and other providers to gauge patients clearly, understand both the potential advantages and the limitations of complementary therapies. They made more informed choices. In practice, this kind of insight can help people ask better questions, stay engaged in their care, and choose strategies that fit their health goals, which may support better adherence and more balanced diabetes management over time. So going back to, we have a little bit more time. There were a couple of more evidence-based treatments, such as the insulin therapy for type 1 diabetic guidelines. If you would like to read up on that, the presentation is also included. There was a prototype of a tool to aid in individualized treatment for type 2 diabetes. So I recommend you read on that. We're going to go ahead and end the presentation, and hopefully you learned a bit more about diabetes management. Have a great day.